Hi and welcome to my scenario today. So a bit of an introduction. We've been called to Bethel's Beach. Lifeguards has found a 36-year-old female who's been witnessed seizing on the beach and has a laceration to the left side of her cranium. The lifeguards have taken her back to Bethel's Beach Surf Lifesaving Club and we've arrived. I will be doing. Hey Maggie, so the lifeguards brought you up. What I'm going to do is I'm just going to do a basic assessment, get an idea of how you're feeling, and also just do a cranial nerve exam, just checking all your nerves in your face are working properly. And then what I'll also do is I'll do a musculoskeletal examination on your head and just make sure that there's no other injuries or anything like that. Do you consent for me to do that?
Yeah,
cool.
That's okay.
Okie dokie. So I heard you slipped over on the rocks. Okay, so that's not good. Lifeguards have dealt with you and brought you in. Are you experiencing a headache at the moment?
Yeah,
or
it's
like that?
really sore.
Yeah, so it's really sore. Where's it located?
Like sort of the side here,
Okay.
on the left.
Okay.
Up here, yeah, it's really sore.
Okay, dokie. Do you normally have headaches?
No.
Yeah.
No, this is strange.
Okay, so it's not often that you have headaches. Okay, dokie. Have you ever had a head injury before?
No.
Okay, no, never before.
Not before.
Okay. Do you experience any are you experiencing dizziness or lightheadedness?
Yeah.
A little bit lightheaded?
A little
okay.
lightheaded, yeah.
Okie dokie. And also when you were standing up and stuff after the accident, did you have any dizziness or loss of balance or anything like that?
A little bit, yeah. I found it hard to stay
stationary?
Yeah.
Okay, cool, thank you. And also have you noticed any changes in your vision? Is it a bit difficult to see?
Not really. It's just the pain.
Just that pain. Okie dokie. So what I'm going to do is I'm going to do a cranial nerve assessment on you, okay? And it's just going to check out cranial nerves, okay?
Okay.
If you feel just uncomfortable at any time, just let me know, okay?
Okay.
Cool, thank you. Okay, so when you had the accident, after the accident, do you remember anything?
Yeah, I remember the surf lifesavers.
Yep, so you remember the lifeguards, you don't remember anything prior to that?
Not really.
No? Okay, cool. Okay. With the smelling right now, can you what's normal for you to smell? Can you smell things or do you normally not?
I usually, I smell good, normal, I think.
Okay, so normally smells quite good, okay. And your seeing, as you mentioned before, wasn't too bad?
No, it's fine.
It's fine? Okay, cool. Okay, so what I'm going to get you to do is I'm just going to get you to look at my ears. Okay, and I'm just going to have a look at your pupils. Okay, I'm going to shine this little torch.
Okay.
And what it's going to do is going to look and give you an idea on what your pupils are doing, okay?
Okay.
Cool, so just look at my ears. Okay, so pupils on your left-hand side is a little bit sluggish, okay? That there is something I'll just take into account a bit later. Okay, what I'm going to get you to do is I'm just going to get you to look at my pupil torch here. And I just want you to follow it with my finger, okay? Okay, cool. Thank you very much. Okay. What I'm going to do is I want you to tighten your jaw for me, okay? And just clench your teeth together. Permission to touch your face. I'm just going to pull your jaw down.
Right.
Okay. And I just want you to try and resist that. Okay. Is that painful at all?
No?
It's
just in
your head. Okay. Okay. Can you give me a big smile, please? Okay. Can you give me a frown? Okay. Can you give me a kissy face? Okie dokie. Awesome. Okay. I'm going to click in your ears, okay, and I'm going to click on this side first, and I'm going to click on this side next, okay?
Okay.
I just want you to tell me if you hear anything different or if you're hearing ringing noises in your ear, okay?
Okay.
Okay.
Sure.
Also, what I want you to remember is blue, okay? I want you to remember the word blue for me, okay?
Blue.
Okay.
Okay.
Okay. How'd that feel? How'd that sound? Sorry.
It's right. Some sort of ringing.
A little bit of ringing.
Yeah.
Okay.
Still ringing.
Still ringing? Okie dokie.
Yeah.
Cool. Okay. Can I get you to give me a swallow, please? Just like you're swallowing a drink of water. Cool. Is that any different?
No.
No? Absolutely fine.
Yeah.
Okay. What I want you to do is just lift your shoulders up for me, okay? Just straighten them, okay? Put them down. I'm just going to put my hands on your shoulders and I just want you to push up, okay? Cool. Nice. Okie dokie. Can you poke your tongue out for me? Yep, nice work. It's nice and aligned. Cool. Okay, so that's all good. That's our cranial nerve assessment.
Okay.
What I want to do now is I'm just going to quickly check your muscle tone in your face, okay, just making sure that sensations all the same. Okay, is that all right? Okay. So what you do is just, does that feel the same across sides? Cool. Okay, can I get you to look up for me? Okay, can I get you to close your eyes for me? Okay, I'm going to try and open your eyes. I want you to try and just stop me from doing that. Cool, nice work. Okay, so what I'm going to do now is I'm going to do a musculoskeletal examination on you, okay? As I can first see, your skin looks good. You're a little bit red, okay? I also had a look at the wound previously. It is very red and you've got a bit of swelling there as well.
It hurts.
It hurts, okay? So what I'm going to do is I'm just going to touch your head and just have a bit of a feel, okay? Do you have any neck tenderness?
No.
No neck tenderness, okay? Just working up, checking for blood on my hands, making sure there's no blood. Okay. Oh, so it's really sore on that side?
Here.
Just over there?
On the left.
Okay, on the left hand side. Okay, nothing on this right hand side?
No.
Cool. Okay, I'm feeling a bit of blotchiness. Okay, yep. Yeah, no, there's quite a decent lump there. Okay. With the pain, okay, what would you rate it? 0 being no pain at all, 10 being the worst pain you've had?
Like really bad, like 8, 7.
Yep, okay, so it's an 8?
Really bad.
Okay, and when I touched it, was it even more painful?
A little bit.
When I was pushing it?
Yeah.
Okay, cool. Okay,
But it's just always hurts.
Okay, thank you. Do you still have full feeling in your fingers and everything like that? Yep, okay. Hey there. So after assessing the patient's condition and vitals were taken, it was obvious that the head injury led me to believe that there was a fall or some sort of mechanical injury where the patient actually fell onto the rocks and lacerated her head. Okay. After that, I decided that she was stable enough after the lifeguards dealt with her and transported her to the medical facilities back at the surf club. I decided to question the patient a little bit more to kind of bring out a little bit more about what happened and the history behind it. After questioning, I discovered that the patient was experiencing a headache and that this was not a normal experience for the patient on a daily basis. The experience of memory loss to anything prior to the lifeguards turning up led to the possibility of concussion. However, with the assessment of the cranial nerves, it was found that the patient had delay in cranial nerve 3 as pupils were dilated and sluggish, and cranial nerve 3 assessment found that the patient was unable to follow the pupil torch, which led me to believe, in combination with cranial nerve 8 assessment or the acoustics, where the patient was experiencing ringing in the ears on both sides, and also with the pupils being sluggish, yet dilated also as well, led me to believe that there was something deeper within the head injury that was a little bit more severe. Upon inspecting the head, large hematoma on the patient's left side of the cranium indicated a bleed from a source, blood pressure being much higher than usual at about 150 over 100, with the patient's consciousness being abnormal, as she was becoming a little bit more difficult to talk to. I believe the working diagnosis would be a brain bleed of some sort or severe concussion. However, it is difficult to diagnose this due to the patient's medical history being unknown and with the level of consciousness that the patient was presenting with. The inability to remember the word blue, which I probed the patient afterwards, indicated that there was also some short-term memory retention that was a bit understand. 3 key points that I will take away from this is, in the fall head injury scenario, I used a cranial nerve assessment to assess the influence of the head injury and to pick key abnormalities of the patient's condition. Given the inability of the patient to follow the pupil torch and with pupils being dilated and sluggish, the patient was decreasing the level of consciousness, meant that the head injury was actually increasing in severity and decreasing the level of consciousness, which meant it was more on the severe spectrum. After my assessment, I was able to create a working diagnosis with the understanding that the patient was suffering a serious head injury. Bar this, all head injuries should be taken seriously and transported to Auckland Hospital.